Hello, welcome to Look East.
The headlines tonight. More criticism of a troubled mental health trust after this man stabbed his wife in a psychotic episode just hours after seeking help from experts.
They were at the hospital mere hours before their death in A&E, and they were hopelessly let go.
Hello. First tonight, the Mental Health Trust in the firing line again after a man stabs his wife to death just hours after the police had taken him to hospital.
In August last year, Thomas Kemp was taken to Ipswich Hospital, but the mental health crisis team decided not to offer him a bed or even carry out an examination. Just hours later, in the middle of a psychotic episode, he stabbed his wife to death and then killed himself. Today, the coroner said the decision by the crisis team contributed to the deaths. We requested an interview with the Mental Health Trust for Norfolk and Suffolk, but they declined. They told us they're committed to learning lessons. This from our health correspondent, Nikki Fox.
Katherine and Thomas Kemp, married young and together for more than a decade. She an IT expert for Fred Olsen Cruises. Her husband, a support worker for student nurses at the University of Suffolk.
Kat was massively into her photography, and so she used to enjoy coming here to take photos of the wildlife.
Dorian Goldsmith, the couple's best friend, in disbelief over what happened.
They're inseparable. They absolutely loved each other. You know, to me back, I've never seen a relationship quite like it. They're both kind of geeky. Both love doing things like Comic-Con together and dressing up. I remember being really short on money one month and Tom was coming in with a shopping bag worth of food, you know. He was the most generous, kind friend I've ever known.
But Thomas Kemp was mentally ill, anxious about his body. This a month before their deaths.
Every time that I've ever needed any help, I haven't just had one person reach out, I've had lots and lots and lots.
Even on his birthday, a clue to his state of mind. His illness worsened, police were called to their Ipswich flat. Katherine Kemp called 999 at 2:50 a.m. Her husband threatened to stab himself and became violent. Police took them to A&E to get out-of-hours mental health help. But two crisis nurses refused to see him. He already had an appointment booked with his regular psychiatrist that morning. Katherine Kemp begged for help, but her husband was discharged. 4 hours later, the couple were found dead at their flat. Mrs. Kemp was stabbed 28 times. Her husband found beneath this window. Giving her conclusion, the coroner Jacqueline Devonish said the couple were deeply in love. Of that, she had no doubt. She said that Thomas Kemp was likely suffering from psychosis, but said it was the failure of the mental health crisis team not to even consider the other options available to them, like offering Thomas a bed or keeping him in hospital to see a doctor, that was a missed opportunity. That failure, she said, contributed to both of their deaths. The couple's family were too upset to attend court. Their barrister read a statement on their behalf.
Both Thomas and Katherine desperately reached out for help, and they were discharged, resulting in us losing our loved ones. There is a need for better systems in the future. They have failed not just Thomas, but his wonderful partner Katherine.
It's a sentiment echoed by the couple's best friend.
And they were hopelessly let go. I'm not blaming one person. I think there was a consecutive amount of failures. They were reaching out for help, begging for help to the services. They didn't put a knife in their hand, but they didn't stop it happening.
Friends and family told the inquest Thomas Kemp would never knowingly hurt Katherine. If he had been assessed by crisis staff that morning, there's a possibility they both could still be alive.
And Nikki's in Ipswich now, so it's another bad day for the Mental Health Trust, Nikki.
It is, and this is actually the third inquest in the space of a week where serious failings about this mental health trust have been raised. In the last inspection, the health watchdog, the Care Quality Commission, also said that the service of this crisis team needed to improve. Now, the Trust has got a new chair and a new chief executive, but neither wanted to speak to us today.
So are they making any changes?
They are. The crisis team at the Mental Health Trust didn't see Thomas Kemp in A&E at Ipswich Hospital that day because they were based in a different place on the hospital site. That's now changing. They're moving the team to the A&E department so they can see patients more easily. They're also putting in a business case to have a psychiatrist there 24 hours a day. At the moment, they finish at 9 o'clock at night. In a statement, the Trust said to us there was an absolute need to learn what went wrong here to prevent another family from suffering what Mr. and Mrs. Kemp's family have been through.
Nikki, thank you very much.